My name is Daniel Wolfson, and I'm the Executive Vice President and COO of the ABIM Foundation. Today, we're here to talk about new lists being released as part of the Choosing Wisely campaign. We'll also learn about efforts to further the impact of the campaign. Before I begin, though, I'd like to thank the Kaiser Family Foundation for allowing it to be in this building. This is a wonderful space, and thank you so much. I'd like to briefly review the agenda for this morning. Dr. Christine Castle, President and CEO of the ABIM Foundation and the American Board of Internal Medicine, will update us all on Choosing Wisely and announce the release of the new lists. I'll share some exciting news about a grant program funded by the Robert Wood Johnson Foundation to help advance the efforts of the campaign in states and communities across the country. Jim Guest, President and CEO of Consumer Reports, will then talk about the work they've been doing to spread the Choosing Wisely conversations with consumers. We will then have a question and answer period with all the partners releasing lists today. After that discussion, a short break, I will moderate a panel discussion on the potential for Choosing Wisely to drive meaningful change. We are very fortunate to have some of the country's leading healthcare thinkers for this panel. It should be a fantastic discussion, and I hope you are interested in hearing their views and perspectives. At this point, I'd like you to join me in welcoming the President and CEO of the ABIM Foundation and ABIM, Dr. Christine Castle. Chris?
Thank you, Daniel, and welcome, everyone. Here we go again. It was actually just about 10 months ago that I stood on a stage a few blocks away at the National Press Club for a press conference announcing the first phase of the Choosing Wisely campaign. 9 courageous societies had joined that campaign to get it started and released the first 45 tests and procedures that physicians and patients should question. Now, we all knew from the beginning that the campaign itself was a kind of unprecedented event. After all, it's not every day that leading medical experts and societies come together and offer specific recommendations to reduce waste and overuse in their own fields. But it's fair to say that the huge splash that it made surprised us pleasantly. And it became apparent to us that we needed a stage twice as big for today's event, both in terms of the numbers of specialties participating and in the interest. In addition to a standing room only press conference on April 4th and coverage in every major media outlet, we also had 100,000 physicians and patients visiting choosingwisely.org in the first 72 hours and many, many more since. Clearly, there was both consumer and physician interest in our efforts. The drumbeat of this interest has continued throughout the summer in newspapers, blogs, and journals, from the New England Journal to the New York Times, from Health Affairs to Huffington Post, from Modern Healthcare and Medscape, Associated Press, Washington Post, Vogue magazine, Women's Day. All told, more than 300 million people potentially reached by the Choosing Wisely message. And I just learned this morning from the Wikipedian in residence at Consumer Reports that since August, there's been 22 million page views on Wikipedia for Choosing Wisely. From a medical perspective, since April, there have been 62 articles citing Choosing Wisely in the peer-reviewed literature and identifying specific issues in the society lists. The original 9 specialty partners are sharing their lists with their members through a variety of channels, and I'd like to recognize that many of them have joined us here today and thank them for their ongoing work and participation. A few examples: the American Society of Nuclear Cardiology made choosing wisely the subject of a plenary session at its 2012 annual meeting and distributed its lists at many other meetings and exhibits. The American Society of Nephrology featured choosing wisely at its annual meeting and took the initiative to produce several supplemental pieces, including videos and journal publications. And the American Academy of Allergy, Asthma, and Immunology worked with Medscape to publish an article on their list that was the most widely read feature by allergists in 2012. And those are just a few of the highlights of Phase 1. There's much more information in your press kits about those accomplishments over the past 10 months. And this is all very gratifying, but what's most gratifying is that we've begun to stimulate a conversation about quality, safety, and patient-centered care, along with reducing unnecessary tests and procedures. Patient empowerment and appropriate care is what Choosing Wisely is all about. It's about the conversations, informed conversations between physicians and patients about the right care at the right time for the right patient, and changing the notion that more is always better, and helping people understand that more can also sometimes be harmful as well as wasteful. We all know that studies show as much as 30% of what we pay for in medical care in the United States is duplicative or unnecessary and provides no benefit. So for physicians, it's our ethical and professional responsibility to make sure that our patients get the care they need and that precious resources are not wasted. Thus, being able to have informed conversations for personalized decision-making is a critical role that we can and must play. It's something that the Specialty Society partners in Choosing Wisely have recognized and are leading the way. Before we go on, I want to recognize a few important names and the roles they've played in getting us started. Some of us were talking about this upstairs. This campaign began with a physician medical ethicist, Howard Brody, whose essay in the New England Journal of Medicine called on physicians to identify in their practice 5 things. Surely everyone must be able to think of 5 things that are overused and could be used less, and conversations with patients about that. This inspired the National Physicians Alliance, and I think Steve Smith is here with us today, there he is, to have the idea of creating the top 5 lists in the 3 primary care disciplines, pediatrics, internal medicine, and family medicine, that was published in the Archives of Internal Medicine. And that inspired us, along with our partners with Consumer Reports, to expand this idea with other specialties and with consumer groups. So that brings us to the here and now. Joining us on stage are representatives from 17 different specialty societies that, since our first announcement last April, took on the Choosing Wisely Challenge and developed lists of 5 tests or treatments to question in their specialties. Joining the original 9 specialty societies, these organizations have demonstrated leadership and professionalism. Their recommendations will help practicing physicians better understand the current evidence about treatment options and to offer patients and physicians a way to ask and answer the right questions. The organizations on stage today represent a diverse field of specialties. Each can be a change leader for our profession, and I'd like to take a moment to recognize each of them. Starting with Dr. Glenn Stream on your left from the American Academy of Family Physicians, who I should note is here releasing a second list of 5 things. Dr. Timothy Quill from the American Academy of Hospice and Palliative Medicine. Dr. Annette Langer-Gould from the American Academy of Neurology. Dr. William Rich from the American Academy of Ophthalmology. Dr. David Nielsen from the American Academy of Otolaryngology, Head and Neck Surgery. Dr. Thomas McInerney from the American Academy of Pediatrics. Dr. Hal Lawrence from the American College of Obstetricians and Gynecologists, Dr. Janus Yazdoni from the American College of Rheumatology, Dr. Paul Mulhausen from the American Geriatric Society, Dr. Blair Holliday from the American Society of Clinical Pathology, Dr. James Thomas from the American Society of Echocardiography, Dr. Daniel Barocas from the American Urological Association, Dr. Scott Jerome from the Society of Cardiovascular Computed Tomography, Drs. John Bulger and Ricardo Quinones from the Society of Hospital Medicine, representing adult hospital medicine and pediatrics hospital medicine. So they're presenting not one but two lists of 5 things today. And Dr. Gary Delahaye from the Society of Nuclear Medicine and Molecular Imaging, and Dr. Douglas Wood from the Society of Thoracic Surgeons, and Dr. James Froelich, oh, okay, so we went in the wrong order, Jim, from the Society of Vascular Medicine. So I want to ask you to join me in a round of applause, just recognizing the important work that taken together with the first phase of lists, this campaign has now highlighted more than 130 different tests and procedures that physicians and patients should have these conversations about. The full lists are included on the Choosing Wisely website and in your packets. And on the website, you can also see behind each item the evidence and the research that supports that particular item. These include some very common health practices that we as doctors and as patients are being asked to thoughtfully consider and discuss. Together, we believe that we have the potential to make significant impacts on patient care, safety, and quality. So I want you to think about the fact that these organizations represent more than 350,000 physician members, and combined with our first phase of partners, the Choosing Wisely campaign will now reach a collective membership of more than 725,000 physicians across the country. So I'd like to turn things back over to Daniel Wolfson now for a few minutes to tell us about where the campaign is going with the support of a wonderful grant from the Robert Wood Johnson Foundation, and then we'll have a chance to interact with a number of the specialists here about the specific items. Daniel.
Hello again. Now, rather than stop and rest and count our achievements, we all know that we need to push ahead. That's why today we have several important announcements regarding the future of the Choosing Wisely campaign. First, I'm pleased to share that an additional 15 specialty societies will be coming on board to the Choosing Wisely campaign to release lists in 2013. They include the American Academy of Dermatology, the American Academy of Family Physicians, again, who is announcing a list today, and will have a third list, the American Academy of Orthopedic Surgeons, the American College of Surgeons, the American College of Chest Physicians, the American College of Rheumatology, who is announcing a list today, and will do another one in 2013. American Headache Society, the American Medical Directors Association, the American Society of Clinical Oncology will also have a second list. American Society for Hematology, the American Society for Radiation Oncology, the American Thoracic Society, the Heart Rhythm Society, the North American Spine Society, and lastly but not least, the Society of General Internal Medicine, and there will be more. We are thrilled to have these groups join us, and we look forward to learning more about their 5 things later this year. We're also announcing today a $2.5 million grant from the Robert Wood Johnson Foundation that will take Choosing Wisely deep into communities. Over the next 2 years, we'll have over 20 state medical societies, specialty societies, regional health collaboratives, working at the regional level and state level to raise awareness of choosing wisely recommendations and the importance that often less is better. They will disseminate the recommendations from the list that were released last April and today, together with practicing physicians, moving the conversations from the national media into the exam room. These grantees will also help inform consumers, and they will be helped in this by Consumer Reports, whose activities will also be enhanced by this generous grant. Consumer Reports will use funding from Robert Wood Johnson Foundation to enhance consumer network and work with grantees on their consumer outreach efforts. We are extremely grateful for Robert Wood Johnson Foundation for supporting the Choosing Wisely and helping us multiply the impact of this campaign. So on that note, I'd like to welcome to the podium another close partner who has helped us reach millions of Americans. Jim Guest is the president and CEO of Consumer Reports, the nation's leading independent, nonprofit consumer organization. We're proud to collaborate with Jim and his team and look forward to seeing what the future of our work together holds. Jim is going to update us on the work that Consumer Reports has been undertaking in the last 11 months with the specialty societies in the campaign, along with 14 consumer partners and growing. Jim.
Well, Daniel, I know the American College of Cardiology was part of the first group that did this, but I'm literally, Chris and Daniel, as I'm listening to you talk about this, my heart is beating faster. I mean, literally, it really is exciting. You introduced the 17 people here, looking at what you're doing, that list of what's coming up, Daniel. I mean, and this is less than a year old. It really is amazing what's happened, and we're certainly proud to be a partner in all of this. What we do is we take what you produce. I mean, Consumer Reports is all about evidence, providing evidence-based information to consumers so they can make informed choices about products and services. And this is what you're doing and what your colleagues are doing when it comes to healthcare services for consumers of healthcare. And what we've done is we've already taken more than 50 of the lists that you've already come up with, the previous persons, produced pamphlets like this that we're getting distributed both directly to consumers and also through your organizations and through the docs who are handing these out to patients as well. And then we have, as Daniel mentioned, we have 15 partners, I think it is now. Through them, they're reaching millions of people. So between Consumer Reports with 8 million subscribers to our various products and websites and so forth, about 20 million people a month who look at our stuff with the pass-along. And then you mentioned Wikipedia with the 22 million hits so far since the program began. We have actually a Wikipedian in residence who's been at Consumer Reports since the program started, working with us on this, getting the information up. AARP reaches over 20 million people a year, and other organizations that we're working with. So the information is getting out. We estimate that we have reached, through the partners and directly ourselves, roughly 70 million people with information from Choosing Wisely. And we did a survey last month, or in December, I guess it was, where we distributed information, a piece of information from Consumers Wisely, Choosing Wisely, well, Consumer Wisely too, really, to consumers, and a piece. And then we got feedback from them, about 2,600 plus participants. And what we learned is this: 71%, 72% said that with that information they got, they learned information they didn't already know, or it changed their opinion about the process we were talking about, and or they said they're more likely to talk with their doctor about the information they got from Choosing Wisely. That's amazing. 81%, and even more, said on a topic of interest to them, they were going to ask questions they would not otherwise have asked. So the notion of promoting a really good, healthy conversation between doctors and patients, which is the goal of really making a difference in Choosing Wisely, is really working. I mentioned we have a bunch of partners here. Let me just quickly, I mean, it's great to see you. As you went down the list. I'm saying, yeah, you know, it's great. And let me tell you some other great people who are involved with it. In your packet, you've got a list of the partners that we're working with. Some of them are here today. Let me just quickly ask you to stand and just stay standing while I read your names so people can see. Here you've got the people producing the information, carrying it out, working with the docs. These are the folks working with consumers. I think Leah Binder from the Leapfrog Group. Leah, I'm not sure if she made it or not. I think she was stuck in traffic. Kathy Brandt from National Hospice and Palliative Care Organization. Kathy. Lane Raspberry, he's the Wikipedian in residence. Lane, way to go. Margaret Rahayam from the Midwest Business Group on Health. Margaret, thanks very much. Pamela Rich from the National Business Group on Health. They've been a good partner in all of this. Catalina Rodriguez. Hola, doctor. Catalina, nice to have you here. She's with Univision, which is now enabling us to reach the Hispanic audience in a way that we haven't been able to do before. We're doing these things in both English and Spanish and eventually in other languages as well. Yolanda Taylor from AARP. Where's Yolanda? Great to have you here. And Andy Weber, did he make it or not from the National? Andy, great. National Business Coalition on Health. So thank you for all that you folks are doing. It's a great partnership, and this really is all about partnership. And I want to say to the 17 societies here today and the others participating, I think it's taken a lot of courage for you to do what you're doing. You're looking at yourselves. You and your colleagues are looking at yourselves, looking at the evidence, saying, we're doing stuff more often than we need to be doing it. There are things that are overused and so forth. That was not an easy thing for you to do, and I really appreciate that and recognize that. And then, I know, my two heroes in all of this. Chris, you are amazing. This is really just so fantastic what you've done and what you've started. And Daniel, you're unstoppable in carrying this forward. So for consumers, on behalf of consumers really, and Consumer Reports, thank you for what you're doing. Thank you for what you're doing. Proud to be part of it. Proud of this terrific effort. So thank you very much.
Thank you, Jim. And I'd also, while we're thanking people, I'd also particularly like to thank Lori Slass and John Held from the ABIM Foundation, who have really, this kind of thing is all about communication, and they really are the experts at that. So here, and thanks to them. Okay, so this work, I'm glad that you got a chance to hear from Jim about the exciting work that Consumer Reports is doing, and it really cannot be stressed enough that that is really part of the power of this campaign, that it's the doctors and the patients together who are putting forward this information and making it available and using it. And we are not the experts at communicating effectively with consumers, dare I say it, on behalf of our profession, but these people are, and the partnership is really helping us with that. So now I'd like to turn to our partners seated here on the stage to talk a little bit about their lists and ask them some questions about the process that went into developing them and what they're planning to do to further the campaign. And I've asked everybody to try to be brief because we do have such a large group, and because I want to make sure that we have time before the end of this first session to get questions from you, and then we'll transition into our panel discussion. So with so many specialties and partners here, it'll be tough to hear from everyone, but I'll do my best. So let me start then with a question for Dr. Lawrence from the American College of OBGYN, because as I was doing some press interviews yesterday, actually, the OBGYN recommendations received a lot of attention. I suspect it had to do with the age and gender of the reporters I was talking to.
Works that way.
Right, works out that way, right. So could you just say a few words about what kind of concerns did your organization encounter as you began looking at these lists, and sort of how did the process go in terms of getting consensus about it?
Thank you, Dr. Castle. American College of Obstetricians and Gynecologists are very proud to be sitting up here this morning, and our goal is to make sure that our members and the women of this country continue to get the most appropriate, evidence-based health care that's available. And so our organization, through its committee process, through its executive board, identified several areas, especially some of the prematurity-related areas that we need to focus on, and some of the cancer screening areas, especially cervical cytology. And so we identified those, worked them through our committee and executive board process, and have pushed them forward through the Choosing Wisely campaign. I must tell you that we are doing this in many different venues. We have folks here from CMS this morning, and we have been also proud to be part of Strong Start, which really, our first two agenda items says no non-medically indicated deliveries before 39 weeks. And I'll point out that my good friend Dr. Stream at the end down there, AAFP, has the same word for word list in their 5 today, and that was because these two organizations worked together to do that. Just like we're working with CMS and March of Dimes on Strong Start. And I'll cut it off there. So
Thank you. Thank you. And I do want to point, I'm glad you mentioned that, because there are a number of items on these lists that affect more than one specialty. And I think one of the real strengths of the evidence base behind this is that cross-specialty conversation did occur. And that was, I think, a very important validating part, and to consumers, I think would be very useful that whichever specialist you go to about whatever condition, there's agreement about these things. Let me turn to Dr. Langer Gould and from the American Academy of Neurology, and ask you to talk a little bit about why neurology decided to join Choosing Wisely. What was the discussion about?
So the American Academy of Neurology has been very concerned about the rising cost of health care, and wanted to get in actually with the first round of ABIM, of the Choosing Wisely campaign, because we really feel that it's important that physicians be the first to chime in which practices we're doing are unnecessary, and which practices we do that may actually even be more harmful than helpful. Good.
Thank you. Thank you. Let me turn to Dr. Rich from the American Academy of Ophthalmology. Did you have a similar process, or was there controversy among the members of the Academy?
Oh, definitely there was. Excuse me, Chris. You might have made a mistake. I'm Irish, I don't wear a watch, and I have a microphone in my hand. But, I'll try to adhere to your instructions, okay? It started out with a small...
I'm going to be tough, I'm worried.
I know you can be. I'll choose wisely, yes.
Choose wisely. Right.
I think that it started out with conversations with Dan and his staff and learning from others. We started out with a small group that we all know in our hearts, whether you're clinicians or in academia, that there are things that are inappropriately done. And we then looked at the evidence base through our quality of care initiative, then spread it out through all the subspecialists, opened it up to comment from our board, and then arrived at the where we are now. I hope that this is just the start, the reflection of the emphasis on value in our society. And if we do the right thing, in about 5 years, maybe this won't even need a press conference. So that's our goal.
Great, thank you. Let me turn to Dr. James Froelich from the Society of Vascular Medicine and ask you, this is a society that is very well, as many of them actually in this group, very procedurally based. And does this represent a change in thinking in terms of vascular medicine, or was the knowledge that comes to this moment something that you've been trying to figure out a way to deal with before this?
Well, that's a very good question. I want to thank you, Dr. Castle, and the ABIM and Consumer Reports for spearheading this. As soon as we in the Society of Vascular Medicine heard about this, we were eager to be a part of this. And you mentioned the inherent conflict, which is why I think this is so important and, as was said already, courageous of all these societies to do this. Our society is a mixture of proceduralists and internists and people from many specialties who care for patients with vascular disease. All of us, including the proceduralists who do interventional procedures, want to see the right care provided for patients. It's not about doing procedures, it's about doing the right procedure for the right patient. So this actually is not a struggle or an internal conflict for members of the society, regardless of what they do for a living, because even those who do procedures, as I said, are keenly interested in its appropriate use. We
Great.
all are physicians first and foremost. So if that answers your question, I don't think it was a conflict or a struggle at all. It was what we do, and this gives us a chance to empower not only patients and the lay public with information, but also, as we discussed earlier, to empower physicians so that people feel more comfortable, whether they're physicians or patients, approaching this discussion with the evidence base at their fingertips.
Good, thank you. Let me turn to our experts in hospital medicine, both Dr. Bulger and Dr. Quinones, and to just say a few words. I mean, the conversation is very different for a hospital medicine physician who doesn't necessarily or usually have an ongoing relationship with the patient. Did that make your conversations different at your societies?
Thank you, Dr. Castle. The Society of Hospital Medicine was so excited to get involved. As you said, we have 2 lists, and it's a very diverse field. 70% of hospitals now have hospitalist services or hospitalist providers within their hospital. And we did, one of the difficulties we had in the beginning, when we put the initial call out for recommendations, we had over 150 recommendations that came from hospitals, really asking the question is, what are the things you see in your day that you think are used too much within your hospitals? And what we wanted to do was be able to really bring unique lists out, because much of what we do affects every other specialty within this group. And you'll see in both of the lists, and Ricardo will speak of the pediatric list, that we tried to come up with overarching, really systems-based areas that are done too many times in our hospitals, and that avoiding those could create a great deal of value.
Great, thank you. You want to add anything quickly to that, Dr.
Yeah.
Quinones?
Well, first of all, let me again, as everybody has done, thank you, and in particular, thank you for allowing and encouraging organizations that represent children to also join the effort, and I think it's very important. I think, as you pointed out, a lot of healthcare is either done in repeat care or unnecessary care. And I think in pediatrics, that's an under-recognized problem. And so our list begins to address some of those problems, in particular in the hospital setting where some of those costs are the highest. And so thank you very much.
Great, thank you. Let me turn then from pediatrics actually to geriatrics and people with more advanced illness. Dr. Quill and now I'm blocking out your name. Mulhausen, right, I'm sorry. This is my own specialty, so I'm very interested in this. And it seems to me that those conversations with patients are among the most difficult and I think sometimes in the public eye most controversial. I wonder if both of you could just speak for a moment about your sense of response from patients to this kind of information. Tim, do you want to start with that?
I think getting involved with this was a little bit tricky for us in palliative care because we were concerned that we might be perceived as rationing or holding back on treatment. And we chose to emphasize in particular some of the data that says early involvement of palliative care, not delaying until the very end of life, really actually improves quality of care, helps people make better choices, saves money, and sometimes even prolongs life. So again, this was a real opportunity for us to talk about the many ways in which choosing wisely can actually help resource control misuse of resources, and also extend life by giving people the proper care and the proper time.
Good, thank you. Paul, do you want to add anything to that? Or I mean, a number of your recommendations were also about overuse of medications in older people.
So the American Geriatric Society's mission is to improve the quality of care to primarily the frail and vulnerable elderly. These people have multiple medical problems, they take multiple medications, and they are uniquely vulnerable to overtreatment, harm from treatment, and treatment that may be unnecessary. We wanted to spark conversation between patients and physicians and other geriatric healthcare providers. And this initiative and forum provides a unique opportunity for us to stimulate those conversations. We worked very closely with our colleagues in hospice and palliative medicine to make sure our message was consistent with theirs.
Good, and that then that you agreed on the research that was behind it, right? That was part of the process.
Yes, exactly.
Yeah, good. Dr. Yazdani, let me ask you from the American College of Rheumatology. One of the questions that I've been getting a lot is about sort of what comes next. What are you as a professional organization going to do now with this information?
That's a great question. I think we have two major approaches. The first is that we plan to use really the very well-oiled machine of communication within the American College of Rheumatology to reach physicians. And that includes things like social media, our national meetings, newsletters, magazines, emails, and all of the means available to us. We're also going to be working with Consumer Reports as well as other patient advocacy groups like the Arthritis Foundation to get the message to patients. And then the second aspect, which I think is really important, is that we really haven't done a lot of work in overuse before participating in this campaign. And so there's a research agenda, and that is to identify, how prevalent these things are and how we can actually begin to sort of move things in the right direction.
Good, thank you. Let me open this up now to members of the audience and the press who are here. Yes.
Hi, Dr. Richard Singerman from TrustedMD. We're a partner with Johns Hopkins. Oh, sorry. Hi, Dr. Richard Singerman, co-founder of TrustedMD, and we're a partner with Johns Hopkins. We do private social networks for hospital clinician collaboration. And I also sit on the IOM Learning Health System Collaborative. My question is really, what we're focusing on in our firm is evidence-based communication and dissemination and all those initiatives that ARC and PCORI are doing. So my question is both for example, the pediatrician and the OBGYN doc, as well as for Consumer Reports. What are you doing to take the high-level evidence base or lack thereof and put it in a language that's digestible for people who are at a fraction of the education level, just so they don't worry, is it really backdoor rationing? I think that's a very important part.
So I don't know if any of the partners here, this is really about communication, and so I might actually turn this over to Jim and ask him to, because they actually do give a lot of thought to that question.
I will say, though, that on the communication, though, the notion of evidence from actually guidelines and evidence-based practice centers to the communication forefront, that's really an important gap that sometimes gets hard to bridge.
So just very quickly, we're relying on the experts who do have the evidence and putting it together, and we have experts on our staff who then can take and interpret that evidence and present it. And what we do with our materials, we actually have experts in addition to our own editors who are really good at communicating well, but even our audience is a somewhat more educated audience than people at large. So we're working with some outside folks trying to get stuff at the 6th grade, 7th grade, 8th grade reading level. We actually will take our materials and we'll try them out sometimes on an actual audience. And it's amazing. We've had all these experts and beautiful people, great people on communication. Try it on an audience, and that's where you really get your good view of how to do it.
So it's evidence-based communication.
Yeah.
Right, good, thank you. Thank you, Jim. Other questions in the audience? Oh, yes, sure.
I can help you with that. We're doing that. We are really trying to target our literature at a 7th or 8th grade level through all of our patient education information. At the same time, the co-branding that we've done on Strong Start with March of Dimes and CMS, we've pushed out to all the providers and a public information campaign. And it's echoing the 39-week information, which is right at the top of our Choosing Wisely list.
Good, thank you.
In pediatrics, we not only publish the pamphlets for our patients and families, we also have developed a website called healthychildren.org, which we've had up and running for about 2 years now. It's had over 2 million hits by individuals. And we recently have launched the Spanish version of healthychildren.org. And all of that material is written at a level that you don't have to have an MD degree to understand.
And of course, in this, that's one of the wonderful things about the internet age is that consumers and patients can access any of this information from whatever sources make sense to them. Yes.
A brief comment. We were just discussing this. That's actually part of what Choosing Wisely has done. These, if you read the descriptors, they're actually very simplistic. That was very difficult for us after going through an extensive evidence base we've built from the 80s. So I think Choosing Wisely is already meeting the issue that you're espousing.
Just for the American Academy of Neurology, we considered whether whether we would be able to communicate the recommendation easily to patients before choosing our top 5. So that was actually part of the criteria.
Uh-huh. Interesting. Good. Other questions from the audience? Well, while you're thinking about it, I have a question for Dr. Wood from Society of Thoracic Surgery, because the thoracic surgeons are a group that have really been at the forefront of looking at evidence-based medicine, developing registries, and looking at their own quality outcomes for patients in a field where the practices, because of this kind of research, are actively changing, I think, and people are doing different things are becoming standard of practice in different regions. How is the society going to manage that? How is that incorporated into your choice about choosing wisely, and how do you think about managing that going forward?
Well, Dr. Castle, thank you very much, and you're right, and I appreciate you pointing out the role that the Society of Thoracic Surgeons has had in the past, starting with our clinical databases developed in 1989 in cardiac surgery, thoracic surgery, and congenital cardiac surgery. So we've been all about looking at our own data for improving the care and the quality of care that we provide for patients. So this opportunity to participate in Choosing Wisely alongside like-minded specialties that are up here on the stage and participated a few months ago is exactly what we wanted to participate in. And the difficult part I certainly noticed was many of the early conversations were comments from our senior leadership that, well, I do that, which resonated to me and the others in the process that that's what this is about. These are the things that we do. Those of us in this room have often been the promulgators of practices that are based upon tradition or are defensive medicine or other practices, but are not really evidence-based. So this was not difficult for us at the end of the day to choose 5 things, and I'm sure, like other societies, there are more that we could choose from. But it is a difficult conversation sometimes with our members who say, well, but this is a practice I'm used to doing, and this does give evidence for them to question their own practices as well as to have better conversations with patients about which things to do.
Great, thank you. We have a question over here.
Hi, Andy Weber, National Business Coalition on Health, and again, kudos to the foundation and to Consumers Union for a wonderful national campaign. My question is really looking to the future, Chris, and that is, what are the measures of success of choosing wisely 5 years from now? And I guess I want to put on the table whether we have a mechanism to really monitor and track use rates for the identified procedures to see whether we're having an impact over time. And is that an explicit part of our sort of aspirational goal here in terms of a metric for success?
Thank you, Andy. That's a really good question I've been getting a lot over the last 24, 48 hours as we've talked with the press about this. So let me just say initially that I think the campaign isn't set up to do that kind of research, but the information is out there, and your question is a really good one. How do we know what sort of impact? We have lots of data about the media hits and about who sees it and how many people see it. So what's the real impact? So Dave, you want to take a try at that?
Thank you. I'd like to try to link that question to the earlier question about communications. What gets talked about is what gets measured, and choosing wisely is all about the conversation and talking about it. What gets measured is what gets done, and so your question really has to do with that. The communications, the evidence-based sharing of information is essential but inadequate. And we've done a little bit of initial studies early on looking at a guideline and then trying to see whether or not behavior changed just with communicating that guideline, and it did not. And then when we later on created another guideline with the strength of recommendations that we submitted to PQRS where it's now being measured, we noticed that there was nearly a doubling of compliance with that measure with each successive year because it's being measured. So that really is the challenge before us. Ultimately, this is about shared accountability. The whole purpose of choosing wisely is to recognize that accountability for that measuring and making sure that we get better is shared between the patient and the physician. These events that we're describing are not never events. We're not saying you should never do this. We're saying it's done too much, or it's done inadequately or inappropriately, and that it needs to be discussed and talked about. So we're going to be looking very carefully at how we measure this. I think that we'll have to call on Consumer Reports and others who are going to be reporting to the public using that public language and public communications as to what those results will be. But we have to work through the existing processes of performance measurement. I think every hand on this stage is probably going to go up to answer your question because all of us have to deal with that. So it isn't just going to be about measuring, but it's going to be about quality improvement and making sure that we're pushing for the improvement, not just for the measurement and the reporting.
Thank you, Dr. Nielsen. Let me just, we're coming to the end of this session now, and let me just end. So in response to Andy's question, I think we're going to hear more about that in the panel in the next session, so stay tuned, and that will be interactive as well. But before we move on to that panel, let me make sure that there isn't someone else out there with a question you'd like to, yes, right here.
I'm Naomi Sunshine with Consumer Reports. First of all, kudos to all of you for participating in this. I notice that many of the list items from a particular society are useful for practice in other societies. One, for instance, is preoperative testing topics, which several of you have. How do the societies talk to each other about these, about the Choosing Wisely list items, about overuse that might be happening?
When it affects other people. Let me just say a couple of things and then ask if there's someone who hasn't spoken yet who'd like to take that question on. But one of our, we want to emphasize, we, ABIM Foundation, want to emphasize that this work is all about what the societies have done and what the consumer groups can do with that information. But we did have some sort of ground rules about these 5 things, that if the societies wanted to participate.